So I would like to welcome two CPC members that we have got here to support this discussion, Shirley Guy from Hong Kong and Sonia Roa from Chile, both CPC members and supporting the discussion today. I can just see there's a few more people joining. So small group today, it's not a webinar, it's deliberately set up as a meeting because it should be really on a conversation rather than a formal presentation. So what I will do, I will share my screen and then we can go through the questions that are there. And please do not hesitate to step in, wave, bring up your hand so that we know what's on your mind and what you are thinking about the individual things. So let's share here. So I think you can see my screen. I'm just still busy admitting people here, trying to do the admin side here as well as the introduction to the session. With this, as I said, it's about the clinical seminars. The clinical seminars is a format that is new. We haven't had clinical seminars at Congress in the past. I don't know, Shirley, do you want to give us a bit of, you've been to many congresses, you're on the CPC, on the discussions that we had on clinical seminars. Do you want to give a bit more information about the characteristics?
Thank you, Birgit. So I think the main difference between a clinical seminar and also the focus symposium is we need to have more case sharing and also need to make it interactive so that even clinicians will be able to understand what we are talking about and get involved in the discussion. So I think that is far more important. But if it is kind of focus symposium, like even though they have interaction, but the contents were quite different. So I think for clinical thing, we need to focus on clinical management.
Great, thank you, Shirley. So I found this slide. This is an example of how the clinical seminars will look like. We will have the speakers on stage, and we will have you will see a picture of the audience then later on as well. So that's really the setup with a lectern and the speaker seated on stage. And then what we thought would be helpful for you as either chairs or speakers in clinical seminars to have a few questions to discuss in this group. So I would like to know from all of you, and I know that Shirley and Sonia are also engaged in specialty groups, what would you do or what is your approach to make the session stand out? So there's a program that is packed full of topics related to all sorts of areas across the physiotherapy practice. So what do you think, what would be your approach to make this session stand out?
May I start, Birgit?
Please go ahead.
Nice. Well, I think one of the most important thing is to be very clear your key message. What do you want to share? Because if you have a clinical case, probably you had in your mind why is a good case to share with the audience in this context, no? And this is the most important thing, okay? Why you want to share this case and what do you want that be your key message? That is one of the main things. And you need to be very clear and very specific. Probably you can leave some question to the final of the the session. Not all the time need to share all about your patients. Just be clear with the key message and the mainly point that you want to share with the audience. That's my advice.
Yes, thank you, Sonia. I think that's really, building everything around a key message that you want people to take away from this session. Because after 3 days of lots of content, lots of presentation that people have heard. So how to make sure that your session is the one that when they come back to their clinic and to their practice the following week, that they say, oh, yes, there was this clinical seminar and I remember what they said. Are there any other suggestions from the participants or from the two CPC members? Shirley, I don't know whether you've got anything you would like to add.
I'm happy
So
to
perhaps at
oh,
some
sorry,
point,
Shirley.
oh, sorry, Melanie. So I will echo with what Sonia just mentioned. The most important thing is the key take-home messages. So let the audience know that what are the most important thing that you want to deliver in the clinical seminar, and especially they can make it and possible to apply it in their clinical practices. And the other thing I think is the interaction with the audience that will make the seminar more lively, which is quite different from the other traditional presentations. And the most important thing is consider the level of the audience, because very likely that the audience level will be quite different. So when we are setting the content, so we need to take note about these. So sometimes we don't expect that the acronyms will explain everything or even short-term abbreviations. So we may need some long-term or the full details, and at least let people know that what we are talking about. And we need to be careful regarding slides that we use, because if we have so many information, we want to tell the audience, but beware about the timing and also how you set the information. For example, clear questions, clear messages, so that the audience will be able to get it and then will be able to share with you. So
Right.
Melanie, your turn.
Yeah, thank you, Shirley. So before we go to Melanie, I would like to pick up 2 points that you made, Shirley. I think one is when you talked about the acronyms, it's about also recognizing that a high percentage of our Congress participants will be non-native English speakers. So taking this into consideration, and what you said, the level of expertise. So when there might be a topic, let's say around, just as an example, women's health, and there will be people who have lots of experience in that area, but you would also have people in the audience who say, oh, that's an interesting topic. This, is something that I see in my clinic every now and then, but they are not the experts in the field. So really catering for all these kind of levels of knowledge is tricky, but I think an important point, Shirley, that you brought up. Thank you. So Melanie, please, over to you.
Oh, thank you. I was just going to add that the topic of our clinical seminar is on falls prevention, and I think one of the ways that we're going to try and approach it to make the session stand out is that we've got different perspectives. Yes, with the clinical focus, but different perspectives from very different countries and different health services and different focus as well. So I think one of our speakers is going to be looking at the perspective of the physiotherapist and their knowledge and perception about falls, whereas somebody else is, so it's still very relevant to the clinician, but just from some slightly different angles as well, so that we're not sort of we're all singing from the same song sheet, but just coming at it from slightly different angles.
From different perspectives. Thank you, Melanie. Any other contributions from those participating? You can also put it in the chat if you feel this is more, you would be more comfortable in this. Let me just see whether I can see my my chat here. I'm running out of screens, it seems. But perhaps Shirley or Sonia, if there's anything coming up in the chat, I think that would be great if you could flag this. So I would then go to the next question, thinking about the audience. You as the speakers and the chairs, you might be in an educational role or in a researcher role or in a leadership role in clinic. So thinking about the audience, where we know that a high proportion are clinicians or who identify themselves as clinicians in their main role, what do you think the audience of, without talking about the topics, will be most interested in when they hear, okay, clinical seminar on So again, changing the perspective from the speaker and the chair to the audience. Any thoughts?
So Sonia, perhaps I go first this time. So actually thing is how they can apply the knowledge or the information that they receive from the clinical seminar, apply to clinical practice. will be important. It's just quite different from just research-based thing. So I'd rather make it practical and is usable, and I can translate the knowledge that I got from the conference into my clinical practice or even the research practice. But having said that, we still need to make sure that we are doing something that is evidence-based practice. So I think I like the idea that Melanie mentioned that different speakers, they meant from different countries, they can also discuss what's their perspective are, and especially countries' practices could be different, and also the way that researchers work on something and also clinician work on something could also be different. So it's good to hear different perspectives, point of view. So I think that's what I think will be important. So how about Sonia?
Sonia, please go ahead.
Yeah, thank you. Thank you, Shirley. I totally agree with Shirley. I think that in clinical seminar, we need to keep in mind, as Melanie says in the chat as well, the key message, okay? But who is how do you want to deliver this key message is one of the point. Maybe you can use an inspirational phrase, or you want to share data that you have about the patients, or some maybe will be your experience with why or no, how you want to deliver this key message as well. This will be other level of reflection about your presentation, but it's good because probably you, of course, you will have some very few minutes to deliver it, and how you want to do this deliver is key as well.
Great, thank you, Sonia. I think you brought up a very important topic, which is the length of the session. And the 1 hour is, there isn't a lot of time and it will fly so quickly. And really being very careful, as you said, focusing on really what is the key message, what you want to get across, because otherwise you can get really lost. And usually the topics, someone was talking about falls prevention. You can easily have a day or 2 days event on falls prevention, and this I think applies to most clinical seminars that are in the program. I think that's being aware of the time that you have and what is really that you want to pass on to the participants that they can use in their clinical practice or in their, I don't know, educational setting or their research practice. Thank you. That's really helpful. Are there any other, you are speakers or you are chairs of clinical seminars, any comments from the audience, from our participants today? Anything that you have got in mind as a tip for others or something that you've been thinking of? That's, as I said, if you've got any additional thoughts, please make sure you put them in the chat. Oh, I can see there's something in the chat happening. I just need to move over here. So we talked about, yes, take-home messages and how these changed the practice of anybody's who's participating, I think is really also very important. And really about thinking about the applicability, not just from a speaker and from your researcher, educator's perspective, but really from those who are joining the session. I think we already talked about the to making the information that is conveyed applicable. I don't know, Shirley or Sonia, have you got any other thoughts on the applicability? We said, okay, really having the different perspectives. A topic is being explored, the case study taking center stage. Is there anything else that you would recommend the seminar chairs or speakers on the applicability?
So actually, when I and my colleagues, when we are planning the clinical seminars, we are discussing that, for example, if we're using some clinical tests that require expensive equipment, it may not be applicable for all clinical settings. Definitely it's for research grade, but then in clinical practice, it may not be applicable. So when we are planning this, we also need to think about, oh, what if it is in a low income country? What if it is just a normal usual clinic? So how can we use that, the results to work on that? Or can we, for example, still the same type of measurement, but we use other kind of equipment that is practical and easily accessible in the usual clinic. So that will also be helpful. So when we are planning this, we are sort of thinking expensive equipment, but we also can use some easy and simple tools that can also do similar effect. So that's something that we need to consider, making it applicable to different setting instead of just limited to the research setting. So I think that will be important that we can deliver the message from different point of view and from different angle so that we can simply make the results that is applicable in clinical practice instead of just for one levels of research.
Yes,
So it'd be good to generalize the application.
Absolutely, Shirley. You talked about any equipment and also the assessment tools. So really, ideally referring to any tools that are freely available. I think this is always appreciated by Congress participants that they can really use this. Also, if there are any tools that you're recommending that are freely available or at a low cost, it's sometimes also worth including links because your presentation will be available, will be recorded and will be added to the Congress archive. So people who are interested in that topic area can really look up the details and can look up the presentation and say, oh, yes, Shirley recommended this assessment tool. I would really like to know more about this when you're back and have got more time to reflect on individual sessions and what has been said. Sonia, would you like to add anything?
Regarding the clinical or the different context, in my experience, one of the most beautiful things in one way is that we are sharing with colleagues from around the world with different contexts about their profession. Because, for example, not all physio have the opportunity to have in their country a primary reference, no? We are not first contact of the patient, for example, no? And we share with different levels of development about our profession. And you, as advice, please keep in mind low countries context and level high economic development of countries. Health system are different in many cases. Probably you can have doubts or questions at the end of the seminar regarding your health system or about how you can, what's possible to get to direct access of physiotherapists, as for example. This thinking in clinical, no, not only in research, but that's in a good point as well, because if you are wanting to do research, you need to take in your mind how is the health system. But in clinical setting, probably it will be very nice to share the differences with other countries. No, that's one of the beautiful things to share with other colleagues around the world.
Yes, thank you, Sonia. I think you mentioned this point of different regulations in different countries and settings people are operating. Absolutely. I think keeping that in mind, that what is applicable in one country might not apply in a different country. I think really having these different lenses on. So I think this also leads on to the next question, thinking about how the case studies are, I put down here, are integrated in the session, but I think also about how they are being selected. So are you selecting a case study that is applicable in this topic area quite widely, or are you selecting one that is a niche and really to make a case for something that is quite unusual and helps the thought process of unveiling what is needed for this case? Or do you select two different case studies in two different cultural, economic settings? So I would be interested in on how you select or selected the case studies that you're planning to use. Sorry, this is a slight change in angle of the question. Yes, Melanie, please go ahead.
I'm not sure yet. On Thursday night, we're doing a run through with the other speakers, so we'll see what their thoughts are. But I went from having quite a sort of specific case to then really tweaking it so that it helped. It helped convey the messages that I wanted to. So it's become a sort of a merging of a few kind of cases. The first one was a very real life case, but quite detailed. And actually I found that, but by the time we split the time up between the four of us and allow enough time for questions to drill down into a really detailed case, where you're actually trying to only flesh out a few specific bits to talk about in relation to your topic. I kind of took the other approach and sort of didn't spend too long on the case, but then kept kind of referring back to it and making sure that everything in the case was relevant to what I wanted to speak about. So yeah, so I sort of did a bit of a bit of massaging the the edges of the case to make it work. But yeah, I'll see whether the other speakers are happy with that on Thursday.
Yes, thank you, Melanie. Any other thoughts, Sonia or Shirley, or any of the participants in this session?
So actually, when our team are discussing about the cases, we choose we are thinking about choosing 2 or 3 cases for discussion, because 16 minutes seems long, but it also seems short. So we also need to think about how we distribute the time for discussing this kind of cases. At least we need to have some background information provided to the audience, and then with some question timing for them to work on it. And when we are planning, we also think about the equipment issues or of the assessment tools, because for some equipment it could be quite fantastic and very accurate measurement, but it is not applicable for other areas. So when we are doing these case studies, we are also thinking using different tools, higher tier equipment, and also some general and easily accessible assessment tool for measuring similar thing. So we are trying to discuss from these different angles, and also let the audience from different levels and also with different kind of equipment and understand how they can apply it in their work, or even for clinical setting. So that's how we develop our work. But then we also think about, or perhaps the level of audience could be quite different. So there will be some dilemma regarding clinical reasoning, how they perceive that, whether or not this case is suitable to proceed on this kind of sophisticated exercise test, or they need to use some mild exercise test to do the assessment. So we will also bring up this kind of discussion issue, some dilemma, to let the audience think about it. So I think this will be something that we are discussing, and how we choose the case.
Thank you, Shirley. There are no other comments on the how the case studies are integrated or selected. Perhaps we can move on to the next one. For those of you who have been to World Physiotherapy Congress before, I'm sure you've been in sessions where you felt, oh yes, these presentations of this session, of this seminar, are really complementing each other. They are setting up a picture that is really I don't know what word to use in English, that is comprehensive, and it is really well thought through. But there might have been sessions where I think, okay, there's a few experts on stage, but each of them is talking about their different area of research, but it's not really the kind of missing the combining elements, and what brings these individual research areas or experts together is sometimes missing. So I think, how are you planning to bring the presentations together so that they complement each other? It's also, depends on the, I would say, on the personalities of the speakers. There are some who are very much into, yes, let's bring this together and have one really coherent, harmonic unit, or some preferred to say, oh, but I want to do my thing. So have you got any tips for the participants in this session and for the seminar chairs and speakers in general?
Hi, okay, I can start now. Well, in my advice is that probably you have a learning objective in your mind. No, when you want to finish the session, you want that your audience gets something in their mind, and it's so similar to educate, because you have a pathway, a way to deliver the message, and how to tell the story. How do you want to tell the story about your session in completely? And each case will be each part of this story. Maybe you can use things like storytelling, for example, to to share your ideas and the cases, but you need to keep in mind the pathway, the way that you do, beginning with some point at the end of the session, how you want to tell your story, no, to get to the audience get the learning objective that you want to keep in the mind of the audience when they left the session. That's my advice. Maybe it's a strategy, maybe, no, to how to share
Yes, I
your
think that's
ideas.
really a great metaphor, you know, the storytelling, to say you really, okay, each of the presenters bring their element, but there's this red thread that goes through, and you're all, yeah, bringing this together as one unit within the key outcome and the key learning, as we've been talking about before. Thank you, Sonia. I think much appreciated. Yes. Any other tips or recommendations or thoughts that you have on this? Quiet audience here today. I hope that you will be more involved in preparing your sessions, but I can also understand that you would like to perhaps more listen in and hear what our two CPC members have to share. I think we already talked quite a bit about the take-home messages for the audience. It's really about structuring your session around the audience. So what is the audience, what is helpful for the audience, and what is helpful for them to take away? So let's move on to the next slide. This is not moving on. So we talked about the audience before, and whilst this is a picture of a big hall from a previous World Physiotherapy Congress. We do have around 4,000 participants at Congress, so, and there's a number of sessions that are taking place in parallel, but this means there will be a couple of hundred people in your session. So thinking about I think the diversity, we talked about the level of expertise already of your audience. Again, a piece of information, if you would like to get to know more about your audience, we do not have a formal polling tool in the app, but you could use Mentimeter or Slido. So if you as the chair or speakers are really interested in and have one or two questions for your audience, really, I think this is often appreciated by the audience, so that they have an opportunity in addition to individual questions, because when one person gets up and asks a question, this will be about their setting. But if you have got anything that I think would be helpful and enrich your session, then why not have one or two poll questions for the audience? Or you could also go the traditional way and say, okay, rather than using a polling tool, you could say, okay, stand up if you agree with this, or I don't know, sit down, or at the end, you know, there could be a few questions to get people off their seats and indicate their position, bring up both arms or bring them sideways. So it's a very traditional way, but after all, we are physiotherapists. So, why not having an element of physical activity to activate the audience? Yes, so this was really my point on the audience and encourage you to get them on board, either through individual questions or really on ways to ask them to contribute. Then another item before we move on to the next slide is that there is people will also be able to ask questions through the app. So clearly you will have, so if you open the floor to any questions or comments, there's the audience in the room in person. But these people who are in the room can also ask a question through the app, because not everybody is comfortable in standing up and asking a question. As I certainly know the situation when it takes a while to phrase your question, and it's sometimes easier to put it in writing when English is not your first language rather than standing up and asking the question. So this is just a note for the chairs that this is also an option that is available and to keep an eye on. Sonia, you've got a point.
Yeah, just a technical advice. In case you use Menti or Kahoot or other type of pool, please be sure that it works. No, yeah, because probably Menti, you need to open the page of Menti that it works. Then probably it's like I don't know. It's just to guarantee that the Menti it's working while you are presenting, because not always works, and you can be nervous if it doesn't work in the moment, and you need these minutes because each minute is very valuable, and that's one point. You need to go to probably the speaker's room to be sure that your pool works.
Yes.
Other point is, of course,
Yes, I think
analog.
that's a good tip, Sonia, because I remember that we had this in the past, that chairs tried to put up a poll and then suddenly say, oh no, let's not do it because it's not working. So, and I think it's a shame when people, the panel and the chair have put in the time and the effort and thinking about questions, and then it's not taking place due to a technical hiccup or so. Yes, that would be really a shame. But we have really good, I was told we have very reliable, good Wi-Fi. So that is also, when you've got patchy Wi-Fi, this is also something where you might struggle. But this is, we really have a, from what I was told, really good Wi-Fi settings. So that should be okay. Shirley, have you got any other recommendations or thoughts on the audience perspective?
Yeah, thank you, Birgit. Actually, I totally agree with what Sonia mentioned regarding the checking of a technical part beforehand, because there's something that our team has been discussed before. We also mentioned, I also once thought of using the Mentimeter, but then I'm thinking, oh, when I use it, I need to upload to the Mentimeter website, and I need to work on something there so that the audience can see the real-time interaction. But then it's lucky that Birgit mentioned that the Wi-Fi is good, so then perhaps we can also work on this. But then think about the other thing. If you're not competent or not feel comfortable, or some of your members are not comfortable with the technical part, then I think what Birgit mentioned, simply standing up, raising a hand, that would be something to make it easy and give you less pressure, and you can focus on your clinical seminar content. So I don't always think that technical would be one thing that you may need to use it, but simply physical work, raising your hand, standing up will be something that is also as good as just using the technical work. So make your presentation in a simple and your comfortable way.
Great. Thank you, Shirley. I think that's much appreciated. And as you said, taking the pressure off. So then the session chairing is, we have got the panel, but we also have the chairs, and this is why I put a few points together for the chair really to think about prior to Congress and also on the day. So you can see it on the slide. So do you feel your panel is well prepared? Are there some speakers who need a bit more guidance, need a bit more help? You know, it could be due to language issues, or it could be that they are fairly new to the topic area, and they would appreciate and benefit from a bit more support. And then, is there sufficient time allocated for question and interaction? We said before it's only 1 hour, and 1 hour flies super fast. We already covered the point. Are you planning on using polls or any interactive elements to get a perspective from the audience? And then I think for the chairs, will your presentations be uploaded individually or as a session slide deck? I think also for you to consider. And when Sonia and Shirley, when you said before about checking in the speaker preview room, if they are uploaded individually, making sure that they are in the order you want them to be, so that there's no surprises and no fiddling around on the technical side during the session. And then on the day, again, these are very practical things that we usually give out to speakers, to the chairs of the session. Make sure that the session starts on time. Step in if needed to bring a presentation to an end, because we all, you know, we've been there, someone speaking and the nerves are playing and there's so much to say, and then suddenly people forget the time and you as the chair then really, you know, find a way to gently bring this presentation or this contribution to an end. And then also encouraging the audience to contribute or to interact, as we mentioned before, a few ways this could look like. And then I put down here, pass on any relevant information. So there might be something from World Physiotherapy where we say, okay, could you please, I don't know, there's the next break will be, instead of 15 minutes, will only be 10 minutes or whatever. If there's any announcements to make, it would be great if you could pass these on. And then important for the audience, for the chair to remember and remind the audience to rate the session on the app. And this is when we look at the evaluation after the Congress, we can clearly see where the chair has reminded the audience, because this is a session where there's many ratings. And we can see the sessions where the chair didn't remind the audience, because this is a session where only 2 or 3 people have gone into the app and rated the session. So I think that's really important for you as the panel, for us as World Physiotherapy, and then also for future planning to really get an idea on the session, how it was perceived, because this will help the next Congress Program Committee on thinking about topic areas, thinking about formats. Clinical seminar, this is the first time that we have this format, and to understand, is this something that is appreciated by the audience, or is it something that they say, yes, it's nice, but you know, being a bit indifferent. So that's so crucial to have the feedback. And then also important, close the session on time, because we have a strict program and very short breaks in between. So these are really the kind of practicalities, technical things around it. Shirley or Sonia, are there any other points that spring to mind when you see this list?
Well, I think the most important thing is the time management, because very often when we are the speaker, we are very excited and we want to share a lot of things with the audience, and sometimes the audience response is sometimes it's uncontrollable. That means they are very excited and they want to share more. But then time is important, just like what Birgit mentioned, because the program is very tight. So perhaps we also need to make it nicely to let the audience know that I think it's important, perhaps can do it in the beginning, that, oh, perhaps we need to keep our time short and tight. So in case the time is up, we may nicely let you know that, and you may please stop sharing, and we can have some more discussion afterwards. So I think perhaps we can make it upfront and let the audience know that we may step in a little bit and interrupt a little bit. Hope that they won't mind, and we can share the discussion later on after the section to keep the time in a tight schedule.
I think Shirley brought up two very important points. So one is there could be further discussion, on the corridor after the session, if there's someone who really would like to speak to you as the panel and would like to have a follow-up conversation, as some people do. But then also, when I said before that the app allows for questions to be asked. So if, let's say, there's still people who would want to bring up their questions and the time is running out, you can always encourage them to put the question in the app, because it will not get lost. And then you, as the chair or the panel, can then address the questions after the session. So that's another option when there's more questions than the time allows, which is great to have an engaged audience, and we don't want to let anybody, back with their questions still open, but there's ways to address these. Sonia, have you got any other practicalities, items that you would want to bring up?
Yeah, I want to reinforce about the time management. Just remember that it's an exciting situation for chairs and for speakers. And probably you need to arrive to the room very early, maybe 15 minutes or 10 minutes before the start, to check it works. I'm sure that all the technical point will be ready, but you need to fix if something happened. Just in case, please arrive early. That's my advice. And I agree that each speaker need to remember the time, but maybe you can agree in advance with each speaker how you or them will let them know when they are approaching at the end of the presentation, and maybe you can because they are speaking all the time. And my experience has been that as chair, the speaker is presenting and try to doing signals, please 2 minutes, do you want more minutes? Please. And to be chair, it's very challenges, because you need to in your mind a lot of things at the same time. The timing, you need to hear about your speaker, because you probably need to prepare some questions. No, you are the host for the audience as well, and it's very challenges. Because of that, I might advise that you in advance prepare your role, no, and try to speak with the speakers how you express about the timing. And please be very gentle with the time, but you need to be strict. And it's okay, because it's your responsibility finish on time, because all the program depends that you accomplish the time. No, then you probably you will have support with the volunteers, that they are very supportive during the session as well. But be very strict and gentle about the time, and all will works well.
Mm-hmm. Yes, I think that's a really important point, Sonia, because when you think about, let's say, platform presentations, so everybody knows you have 8 minutes and you have a timer on your screen. That's also sometimes not easy, but at least you have got these 8 minutes that everybody has. In a session like this, where you're working as a team, you have the 60 minutes, and it's up to you as the chair and the panel on how you distribute time for questions, for interaction, for individual contributions in this session. So it's more fluent, and this can make it a bit more difficult because when you have the first speaker taking already up 20 minutes and there's 3 more people who are contributing, then you might be running out of time. So I think, Sonia, what you brought up is a really important point within your panel. To be aware of this, and also fair to your co-presenters, and look out for the signals of your chair, whatever signals you agreed on. Thank you, Sonia. Shirley, I don't know, have you got any other points?
Well, actually echo with what Sonia and Birgit mentioned. I still remember my last time experience as kind of section chair. So the presenter, they have the timer in front, they can see it. But then I also look at it, but, oh, time is up, and then it's running out. So it's so difficult because because of the setting, so difficult that they can look at me to see my signal. So I think prior discussion within the team to see how you will deliver a signal to them in a nice and gentle manner is
Yes.
important.
Yes, yes, absolutely. Thank you. Thank you, Shirley. So I think we talked through the practicalities. I think this just leaves us whether there are any questions from from the audience, from our participants today. And I would really like to invite you, if there's anything that we haven't touched on, you can put the question either in the chat or raise your hand. Feel free to do so. We have the two CPC members here, and we'll try our best to answer your questions.
Here, one advice more. Maybe you can prepare, anticipate the question from the audience. Maybe you can prepare in your mind or in your discussion as team about potential areas of interest of or doubts or question, and prepare brief answers in advance.
Mm.
No? Maybe you
Yes.
can use with presenting in front of other colleagues from your country, of course, before the trip, and ask, what do you think will be interesting to you? Ask if you will be the audience,
Mhm.
if you will the audience. That's one practice that I use. You can even you can keep notes cards or a slide with key answers and read it if you need it, as well as my advice.
Yes. Yes. And I think what you said, Sonia, also applies to, I'm coming back to this topic of non-native English speakers. So it's relatively easy to prepare a presentation because you can think about the words that you're using. You can think about how you want to express what you want to say. But then when it comes to questions, it sometimes can be a bit more difficult when you're not using English on a daily basis to respond to questions. Yes, but I think we're all here to support each other, and I think the physiotherapists in general are a very friendly bunch of people, I would say.
May I add something there? Because of course that you notice I'm not speaking native speaking English speaker, but you need to be in mind that speaking at an international congress in a language that is not your own is a real achievement, no, itself. It requires extra effort for you, preparation, and courage as well. Most colleagues are aware of this, as Birgit says, and truly value the commitment it represents, no? But of course, there are maybe sometimes maybe a few people who are less patient or understanding. But if you happen to meet someone like that, it might feel uncomfortable. But please remember, you are doing something brave and generous, sharing your knowledge. No, vast majority of people respect that and very deeply, and they are very warm. Then please keep your mind in this focus, because it really is very nice experience, and you are very brave doing that.
Yes, I think that's a very encouraging word, Sonia. And it is sometimes when you think in English you can't express yourself so sophisticated as you can express yourselves in your native language. That's something that comes with international work and going out of your comfort zone. Absolutely, Sonia. Thank you. I think that's really encouraging and important to share. So I can't see any questions on the chat. So if there's no queries from the participants, I can just move on to the final slide here and say, yeah, see you all in Tokyo. So thank you very much Shirley, Sonia, the participants here to take the time for the session. We will upload it onto the resources page of the Congress website, so that anyone who's interested in this can dip in and have a look and listen to the discussions that we had. So thank you very much. Have a good day and see you all in Tokyo. Thank you. Bye-bye.
Thank you.
Bye bye.
Bye bye.